Well, welcome everyone to today's session on program planning and evaluation. Our presenter today is Dr. Patricia Wright. Dr. Wright is a professor of nursing at the University of Scranton in Scranton, Pennsylvania, where she teaches community health nursing, end-of-life care, and research. She is also an affiliated professor in the Department of Health Administration and Human Resources. Dr. Ray has practiced community-based nursing care as a registered nurse and later as a nurse practitioner and has developed numerous community health and wellness initiatives. So just so you know, before I turn it over to Dr. Wright, we will be monitoring the chat throughout. If there are questions, please put your questions in the Q&A section so that I can find them so that we answer them at the end of the presentation. And with that, I'm going to turn it over to Dr. Wright.
Thank you so much. And thank you everyone for being here. I'm really excited to spend this time with you. And I know that you've had some other sessions before, but this one is specific to program planning and evaluation. And we'll break that down into 3 separate sections. And hopefully we'll have a good time for the next 2 hours. So before we get started, where is everyone from? I understand that this session is open to folks from all over. So if you could just put in your chat where you're from, so I'll get a sense of where everybody came from to join us today.
Yeah, and I can read some of these off if you like. We've
Okay.
got quite a few. So we've
Great.
got, let's see here, Pittsburgh, Massachusetts, Seattle, UAE,
Wow.
Arizona, Michigan, Ohio, Wisconsin, Texas, Puerto Rico, Georgia, Massachusetts, Dallas, Maryland, New York City, Eastern Shore of Maryland, Cincinnati again, Milton,
Great.
Massachusetts. So from all over.
Wonderful. Okay, so we have a nice diverse group. And again, thank you for being here and thank you for your dedication to public health and for your dedication to your profession and choosing to become certified. So from here, we'll move on and welcome to everyone. I know many of you are in different time zones, so I hope it's not the middle of the night where you are, and I'll do my best to keep you all awake. So we'll start out with an overall view of what does the CPH exam look like. You've probably seen this before. I just wanted to give you an overview, and you can see right at the very bottom that program planning and evaluation is going to be about 11% of the exam when you take the test on test day. This looks about even with some other sections such as communication, data analysis and informatics, health, equity, and justice. Some are worth a little less, but you can see that this is one of the larger areas that you'll run across in your exam. So we'll spend some good time on this and make sure that we hit all of the important pieces. So our objectives for today are to describe the process of program development and evaluation, identify common models of program development, and discuss development of interventions. And with that, we'll also talk about not only development, but also evaluation of programs as well. So our agenda for our time together is that we'll spend about 45 minutes on program planning. We'll have a 10-minute break, and then we'll come back. We'll have about 30 minutes for program evaluation. And then we'll have 20 minutes for wrap up and questions. Sometimes it moves a little faster, sometimes it's a little slower. It just depends on how much conversation and how many questions that we have. And also, I'd like to invite you, if you have questions at any time, please just pop them into the chat. As Ashley said, the chat is being monitored, so your questions can come up at any time. And don't feel shy about that, because if you have a question, that means I haven't explained it clearly enough, and someone else probably has the same question, so I'll try to explain it again in another way. So don't be shy about asking questions, please. We want to make sure that you get the most that you can out of these sessions. So our first topic that we'll work on today is program planning. Many of you are probably already working in the public health arena and have developed programs, monitored programs, or are part of certain programs that have already been developed. So this should be familiar territory to you. We're going to work on the highlights of things that you may see on the exam. One thing that I would really caution you about, because this is an area that is familiar to many folks in public health, is that when you are answering the questions on exam day, don't rely so much on your own experience. Try to rely on the information that we cover here in this course and that you see in the review book and in the practice test. The questions are not necessarily always based in real world experience because everyone's real world experience differs. So that's something that, as you're adults and you've gained experience, that's a wonderful thing. But when you're taking the test, try not to bring that into the exam with you and try to focus just on what we focus on here in the course and in your other review materials. So program planning topics that we'll talk about today. We'll have a background and introduction to program planning topics. We'll talk about how to develop objectives, program development strategies, program planning models, and intervention planning, development, and implementation. So that's a lot to talk about, but we'll take it one step at a time. So for our background and introduction, you can see that I have a little umbrella here, and this is over all the things that we'll talk about. Program planning itself involves stakeholder involvement. So this, again, is something you may be familiar with, but we'll touch on the highlights and the meat and potatoes of this, so to speak. And we'll talk about how we conduct a needs assessment, which is the first step of program planning. And the definition of a needs assessment is that it is the process of identifying, analyzing, and prioritizing the needs of a population. So if you were to see a question asking about what is a needs assessment, that is the correct answer. So again, always going back to those sort of textbook definitions and not so much maybe what you would see in your workplace, but these are standardized definitions that they would be looking for on the exam. So in terms of completing a needs assessment, you may see this in other ways. You may see it called the community assessment. You may see it called in a community analysis or the community diagnosis. So depending on your background, you may have learned this a different way, and that's okay. If you see any of these terms, it all boils down to the same thing, which is the needs assessment. The process for the needs assessment is on the left-hand side of your screen. And this is something that you may see. You may see questions like which of the following is a part of a needs assessment, which is not a part of the needs assessment. So the first step of the needs assessment is to gather evidence. Every single thing that we do in public health is going to be based on evidence. And that's why I keep stressing not so much what we do in practice, which hopefully is evidence-based, but anything that you see on the exam is going to be completely evidence-based. So gather evidence from your community, from the population, find out what really is going on there and what are their needs. The second step is to analyze the evidence. So we have this evidence, now we want to go through it bit by bit and see what's really going on. In analyzing, after we analyze that information, we'll move on to brainstorming what contributing factors could be. And you might find things that are really surprising. And this is one of the reasons that we want to have the community and stakeholders involved, because we might not always be able to come up with those contributing factors if we're not part of that specific community. The next piece is to get to the root cause. So we may brainstorm and come up with 10, 12, or 15 potential contributing factors, but we want to get to just the few that are really causing this issue. And then the fifth step is to determine the next steps for improvement. So we find the need in very simple terms. We find the need, find the cause, and then we come up with steps for how we could address the cause and meet the needs. So there are the steps of conducting our needs assessment. Are there any times when we might not need to conduct a full assessment? There are a few, so we'll talk about these three exceptions. When one has been recently conducted, if a full needs assessment has just been done in a community or in a workplace or wherever this needs assessment is being conducted, then you don't need to redo it. What we'll do is we'll go back and see maybe if there are some pieces that could be modified, but you don't need to go back and reconduct the whole needs assessment. We also don't need to conduct an entire needs assessment when we have funding that is targeted for a specific issue. So for example, if an organization had monies that were specifically earmarked for a program in smoking cessation, we don't need to do a whole needs assessment to determine if a smoking cessation program is needed. We have the money. That means that someone has already identified this as a need, and we will go ahead and carry out the program. And the third time when we don't need to conduct a full needs assessment is when the planner has a specific need in mind. So for example, if you are working on developing interventions for a specific workplace, the employer already knows what the employees need. So an example of this would be perhaps at a fulfillment warehouse, like an Amazon warehouse. The managers might decide, you know what, we really want to have some teaching and some education and some training around proper body mechanics when lifting. So that need has been identified, and you don't need to go into an entire needs assessment to get to the cause of that. You would just go ahead and carry out the intervention. As we are carrying out interventions, we want to make sure that we are involving stakeholders in our needs assessment. I'm sure that you have all seen the definition of a stakeholder before. And in your work, you may see the word stakeholder in different terms. You may see it as a person of interest, a group of interests. However, on the exam, the word stakeholder is still used. That terminology, although it is expanding, hasn't been changed as of yet. So the word stakeholder is still very much in play as a person, group, or organization that has an interest in the activities of a business, project, or organization. So if you were to see a knowledge question asking you, what is the definition of a stakeholder? That's the answer that you would choose. Stakeholders should be involved from beginning to end to ensure that the programs are developed to and for the target population. And again, you may see that target population term used different ways. You may see different words, community of interest, group of interest. But for the exam, you'll probably still see it as target population. And the stakeholders, whether they are people who are contributing money, whether they are people living in the community, whether they are people who are doing fundraising or writing grants, all of the stakeholders in the project should be able to contribute to the VMOSA. And that's just a little way to help you think about all of these terms together. The vision, mission, objectives, strategies, and action/action plan. So we'll talk about these one by one. This is the framework for how we're going to develop our interventions. So these are terms that you will definitely want to know for the exam, the VMOSA, and you'll want to keep them all straight in your head, not only their definitions, but examples as well. So the vision is a broad statement describing the best possible outcome. So the vision is big, it is broad, it is not something that we can break down and get our hands around. An example would be smoke-free by 23. Yes, I know it's 24, but 23 works better with free. So the example of a vision is smoke-free by 23. If you can come up with some other one for 24, 25, that would be great. So this is a big, broad statement, right? It catches people's attention. It gets them excited. It's a vision, right? That is what we really want to get across when we're using a vision statement. What is our vision? What do we see for this community? Well, we can't do much with that vision because it's too broad to be actionable. So we have to break it down and break it down and break it down some more. So we start to look now at our mission. The mission is more concrete than the vision. And the mission describes what will be done and why we're doing it. So our vision was smoke-free by 23, but our mission is we'll develop a smoking cessation program and support groups. So you can see that from that broad vision statement, we're starting to narrow it in a little bit. And the mission still is, sort of broad, but it gives us direction of where we're headed. The next level under the mission are the objectives. And I know that you're all familiar with what objectives are. But the thing to remember about objectives, if you do see this come up on test day, objectives are very specific. They answer the what, why, how, and who questions. If you look on the right-hand side of your screen, you'll also see that objectives need to be what we call SMART. The S means specific, the M means measurable, the A is achievable, the R is realistic, and the T is timely. So the objectives will have all of these elements built in. An example is within 18 months, 4 smoking cessation programs will be established. So you can see that we went from that very broad vision statement, smoke-free by 23, to the mission statement of how we're narrowing this down, and the objectives now give us something very concrete to work toward and to plan for. These strategies are even more specific than the objectives, and the strategies describe how we are going to achieve the objectives. So an example, we had the objective of running programs and having support groups within specific timeframes, but how are we actually going to make that happen? The strategy is that we'll develop partnerships with hospitals to host support groups. So if we're going to have support groups, we need a place to have them and we need support. We can't do anything in a bubble. So this is our strategy for moving that plan forward. The action plan really takes those objectives and strategies and moves them to a level where we can start to plan out who's going to do what and how are we going to actually make this happen. The action plan describes what steps will be taken and who will take them. It will include resources needed, potential barriers, and possible partnerships. The action plan is your actual roadmap to accomplishing the objectives and upholding the mission. So the action plan is really where the rubber meets the road, where you can start to really see how these things are going to happen. And this is an example of an action plan. And you can see how this all meets that overall mission and vision. And you can break your action plan into multiple steps. This is just one step. Organize the smoking cessation support groups. Now we need to think about who's going to be responsible, who's going to be assigned to that task. This is going to be the person that we're going to go back to and say, okay, this was your responsibility. How did this work out? So you will write the person there. Pearl Jackson from the Health Promotion Committee will be responsible for getting this step in process. We'll have a date of completion because it's always good to have a deadline. For the slides, I wrote January of next year. You would actually write out a day and a year for the date of completion. I just left it open because it's a presentation, but you would actually write a day and time there. Resources would include any monies that you have or need. It doesn't necessarily only have to be money, though. It could also be partners, it could be printed materials, it could be anything that you have or need. So the resources here include a $2,000 public health grant for support of refreshments and education materials. And wouldn't that be lovely if we all had that money? But you get the idea. This is where you're going to line up what you have to make this happen, to actually move this step forward. Then we need to think about what are some barriers or resistance that we have to think about and overcome. So let's think about the community. Local tobacco or vape shops could be a barrier because they're tempting to people. or businesses where smoking is allowed, like restaurants or casinos, could also be a barrier to people quitting smoking. So these are some things that we'll have to really focus on to help people move through this process. And then we have to think about, okay, so we have some barriers and we know that there are some distractors and some resistance, but we also have collaborators. So for this, our example would be the local chapter of the American Lung Association, possibly local pulmonologists or other organizations that could help us to get the word out about quitting smoking. So that is that last piece of the VMOSA. That's your action plan. And you can see how it really goes from that broad vision all the way down to the concrete step-by-step process. Okay, before I move on to the practice questions, does anyone have questions or need any clarification on anything?
We do just have one comment. I had two
Yeah.
comments that some of your slides were cut off. On my side, I don't see it, but maybe could you stop sharing and reshare and see if that
Mhm.
would help for everyone?
Yeah, absolutely. Okay, there's the stop share. You want to make sure everybody can see everything. So
Yeah.
let's make sure.
Okay, so I see step on the left and collaborators on the right. Okay.
Yeah.
Okay,
Can
good.
everybody see
It
that
looks
okay?
good to me. So if anyone has, I hope everyone else can see what I'm seeing. If not, it will be recorded because it's being recorded from my screen. So if it's cut off here for you, then it'll look good for the recording, so you can come back and watch it.
And also, they should all have the handouts as well.
Yeah.
Yeah. Okay, great. Okay, so let's move into some practice questions. I know this is a part that everybody is interested in trying their hand at this, so let's do some questions on this. Practice question number 1. The process of identifying, analyzing, and prioritizing the needs of a population is 1. Needs assessment, 2. Community intervention, 3. Stakeholder assessment, or 4. Health assessment. And you can see the survey that popped up, so you can just answer there. Yay. Okay, you did really well with that. So that is the definition of a needs assessment. That's terrific. Looks like just a couple of people may have gotten the needs assessment and the health assessment mixed up. That's okay. We're just practicing. This is just a trial run. This just gives you a good idea as we're going through the questions of where you can, oh, yeah, I got to remember that definition. So that's okay. Good job. And then you'll see this is our correct answer on the next slide. So great, good work with that. Our next question is question 2. An organization's vision relates to A, a plan of action, B, who will carry out the activities, C, the most ideal conditions for the community, or D, what the organization will do and why. Okay, it looks like this one was one that, okay, we're not 100% sure of, and that's okay. That is all right. So let's review this one. So when you're thinking of the vision and the mission, this is what we're going to think about in terms of the vision. Remember that vision is that really broad statement. What do we think the most ideal condition is for the community? All right. If you can remember that smoke-free by 23 as your vision, it's super broad. This is what we want the community to be able to accomplish. All right. That would be the most ideal. The plan of action is actually the A in VMOSA. And the plan of action also tells us who will carry out the activity. So they're those really concrete steps. And what the organization will do and why, that one actually probably will also show up in either strategies or the action plan. But your vision is that big, broad statement, right? So again, these are terms that are really familiar, the vision, mission, the objectives. These are familiar to you, but if you weren't sure about this one, that's okay. Just go back and kind of brush up on it for test day. That's why we're here, right? If you know all this, you wouldn't want to be here. So, so that's okay. You know it. We're just brushing up a little bit, wiping the cobwebs off. Okay, our next question. Objectives should be specific, measurable, achievable, realistic, and also include a time frame, true or false.
And there is a question. There aren't true and false on the exam, but this is just good practice to know if
Oh,
you know
yeah.
the information.
Yeah, that's right. Yeah. That's a great point. Yes, thank you. Okay, good. You did a really great job with that one. So yes, that is your definition of what an objective should include. So if you see any questions that have these pieces to it, so just know that your objective should always be SMART. Okay, great. And there's your correct answer. And let's try another one. A person who has a vested interest in a business or organization is referred to as a manager, customer, stockholder, or stakeholder. Excellent. Yes, wonderful. So you pretty much all got that one right. It's stakeholder. So the stakeholder is anyone who has an interest in the organization or the community. And you can see on the next slide, this one was kind of tricky, even though you almost got it right. A manager is a type of stakeholder. A customer is a type of stakeholder. The stockholder is someone who has a financial interest. And the stakeholder is anyone who has some sort of an interest. It doesn't necessarily only have to be narrowed into financial. So that one was kind of tricky because they were sort of close together, but you did a really good job on that one. Okay. And this one's a little bit of a bonus question because it's not something that we've looked at yet. And we'll talk about this one as we go through it. An action plan is different from a Gantt chart in that an action plan provides a timeline from start to finish. A Gantt chart includes barriers to meeting objectives. An action plan defines how a group will achieve objectives. A Gantt chart does not include timeframes. Okay, that's okay. That's what I thought was going to happen. So I use this question for a specific reason, and I know you're all like, why did you do this to us today? But this is a teaching moment, and this is why I wanted to use this question. So you may or may not have known what a Gantt chart is, and that's okay. The people who got it right, you may have worked with Gantt charts before, but if you haven't, that's all right. I wanted to use this question to illustrate something to you that's a test strategy. So when you read that question, we didn't go over Gantt charts, but we did go over action plans. So when you read these questions, you might run into things that you say, oh my gosh, I have no idea what that means. I don't remember that from school. I haven't run into it in my job. And you might feel like, oh my gosh, what do I do? Here's what you're going to do. You're going to read each of the distractors. The distractors are numbered 1 through 4. And you're going to choose the one that you do know is true. So we did talk about an action plan. Remember that yellow box that was on the slide that talked about from start to finish, who's going to do what, how are we going to achieve these objectives? So you know that that one is true. You don't have to worry about what a Gantt chart is or what a Gantt chart isn't. You just have to find the one that you know is true. And if you can find the one that you know is true, then you have identified the correct answer. So that's when you're looking at these multiple choice questions, that's a good strategy for you to think about, how am I going to attack this question if you run across a term that you're not as familiar with? Because it's probably going to happen because there's a lot of information here. So if that happens to you, don't panic, take a deep breath and read through the distractors and find the one thing that you know is correct. And that's going to be the right answer because they're not going to have 2 correct distractors. Okay, so I hope you can take that with you as a testing strategy. And you can see there's our correct answer. It's just focused on the action plan. Okay, I know that was a little sneaky, but I wanted to use it as a teaching moment. Okay, does anybody have any questions before we move on to program development?
Yeah, so we do have two questions
Okay,
that
great,
right now. So the
great.
first question is, how do objectives differ from goals? Because I equate
Okay.
SMART goals with targeted objectives falling under that.
Okay, I'm sorry, could you say it again? How do
Yeah,
objectives differ from?
how do objectives differ from goals? I
Oh,
think.
that's a really great question. Okay, yeah. So goals are more broad than objectives. Objectives really get down into the nitty gritty, and that's why I keep saying the word SMART objectives. So you really want to see your objectives having, they're going to be very specific, they're going to be very measurable, they're going to be achievable, realistic, and they're going to have a time frame. A goal doesn't necessarily have to have all of those elements. A goal is a little broader than an objectives, but they are sometimes used interchangeably, and that's why people get confused on that, because that can be a little bit tricky. But if you notice that in the Vimosa, it doesn't say goals. It just says objectives. So that's one thing to think about, that as you're writing your vision, mission, and objectives, then you're going to move on, more specifically. So that's a really good point. So try to really focus in on objectives, how objectives are created, and that they're SMART.
Then the other question is, can all specified time constraints? I'm not sure if that makes sense to you. If not, we can ask them to elaborate more.
What was the question again?
It says, can all specify time constraints? I believe it's talking about the last slide you had up before the questions.
Oh, okay. Let me just go back
Mhm.
to this one, you mean?
Yeah.
Okay, so do you mean for, yeah, so I guess my question is the date of completion? Is that what we're looking at?
Yeah, so I think if whoever had this comment, if you could specify a little bit more of what you're looking for, then we can definitely answer that further. And if not, we can come back to it at the end.
Yeah, I'm wondering too, if the question is, would a time constraint be a barrier? Maybe something like that.
Yeah.
And it could be, yeah, for sure. It could be. And that's okay. We can come back to it. We have time, so don't feel rushed or pressured.
Okay, I think that's it for right now.
Okay. Great. Okay, so let's move on. Sorry, I don't mean to make you seasick, but that's the easiest way to go through them. We'll move on to program development. And this is probably a piece where a lot of you are really familiar with. So this might feel a little more comfortable. So program development takes place in two, I like to call them sort of buckets, two ways. First, you'll develop a rationale for the program. And this is really important when you're trying to explain to people what you're trying to do and why they should give you money for it. So this is what I like to think of as the elevator speech, right? What are you going to do and why is it important? The rationale for the program is necessary for communicating with stakeholders. If people are going to give you money to develop a program, they want to know why and what good is it going to do. In order to develop a rationale for a new program, we need to use national and international data to support the need. So remember when I said earlier that everything has to be evidence-based. It's not just because we grew up in a community and we want to give back now. It's not just because we think that smoking is bad for people. We really want to get those statistics in that community and show this community really needs this intervention because whatever it is. You're going to look at your county quick facts. You're going to look at WHO data, anything that you have to really support the need for this program. You're also going to define what is the cost of the program and what is the return on investment. And cost can be estimated, and the return on investment also can be estimated, but it doesn't always have to be in terms of money. It's easy for people to see money in the air. So if you say this smoking cessation program will decrease the burden on hospitalizations due to smoking related health issues by 20%, and let's say that that accounts for 10,000 patients a year, people understand that. They get the numbers. But it can also be the burden on families who are providing care for people who have life-limiting lung diseases and so on. So you can really paint the picture there quantitatively and qualitatively to develop that rationale for your program. Your rationale should also focus on the health need and establish the relationship between the health need and the target population. So you're going to take all of that data that you have and talk about the broader picture. So for example, I'll stick with the smoking example. You can talk about how smoking related health issues are such a problem across the United States and across the world, but then really also bring it into that population that you are specifically interested in. Why, out of all the places in the world, do you feel that this population is so important that we have to run this program here and now? So that's what you really want to think about when you're developing the rationale for your program. And then once you've painted that picture of, wow, this is such a big problem, and it is such a big problem in this community specifically, then you're going to say, da, 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 I have the solution. The solution is this program. And these are the expected outcomes. And this is how this program is going to help this population so that people see, wow, you've really come up with something that's going to help people. So that is your rationale. And once you have that rationale for your program, then you can start to bring people on board with you to help you really plan how to get this to work. So again, we can't do anything in public health in a bubble. We have to have a team. We're like the Olympics here. You're going to gather a planning committee and conscientiously develop that team. So these aren't just people who are your friends who have an interest in this, the people who are going to help you. You want to compose your planning committee and your team according to the program needs, the resources, and the situation. So you really want to get some nice diversity and expertise in your team. And design the team to foster program ownership. So whoever is going to be on your team, you want these people to be really excited about it. You want them to feel like they own a part of this. Include those key stakeholders. And again, stakeholders are people, hopefully, who can help you finance this program, but also the stakeholders are going to be people who live in that community, who grew up in that community, who have a vested interest in that community. And lastly, ensure that your team can contribute meaningfully to the program and the outcomes. So yes, it's nice when someone comes in and drops you, a bunch of money and says, okay, run your program, but then you're sitting there with a bunch of money and no help. So the team should be able to contribute meaningfully. Who's going to do what? When you envision that action plan, who's going to be listed there in the action plan to really help you develop this program, and who's going to take responsibility with you in that community to develop this program. So these are the two main pieces that go into program development. And likely all of you have done at least pieces of this. So these are just, laying out the steps concretely so that if you were to see any questions on this, you kind of have it in your head. Oh, okay, this is how we move through this step by step. In terms of program planning, there are several models. Some of you are more familiar with these than others, and that's okay. If you're not familiar with them, you're going to get familiar with them. And I'm going to hit on what I like to think of as the big four here. So these models are general models. They are not specific to health promotion, but dimensions of these models do show up in health promotion models, and we'll talk about those later. But we will start with just these five for now. Sorry, the big five. The first one is the generalized model. The second is the planned community health model. The third is the assessment protocol for excellence in public health. The third is mobilizing for action through planning and partnerships. And the fifth is map it. So we'll take each one of these on their own. So the generalized model, this might look familiar to you. Most models of program development have all or at least some of these features. This model, it's called the generalized model because it's very generalized. Sometimes the terms really are just what they mean. They're not trying to be tricky. So the generalized model has 5 steps that include assessing the need, setting goals and objectives, developing the interventions, and implementing the interventions, and then evaluating the results. So assessment, setting goals and objectives, developing the interventions, implementing interventions, and then evaluating. I'm sure that that sounds extremely familiar to you because, again, this model is one that is used in many different situations, from business to healthcare to public health to education. It's used in all sorts of settings. And again, pieces of this you will find in other models as well. The next model that we'll talk about is the patch. This is the planned approach to community health. And probably you have seen this before in your work. This model was developed by the CDC in 1983. It is used in partnership with local and state health departments. So that's what sets this model apart. It's used with local and state health departments. You probably will not be asked specific pieces of the models on the exam, but it's important for you to know all of the models because they may be also used as distractors, and you want to be able to understand what you're being asked and how to answer the questions. So the key piece for the patch model is local and state health departments, and it consists of 5 phases of program development, which again, you will see echoes of that generalized model here. mobilizing the community, collecting and organizing data, choosing health priorities and target groups, choosing and carrying out interventions, and evaluating the patch process and interventions. The next model is the Assessment Protocol for Excellence in Public Health, which is the APEX-PH model. This is one you're probably familiar with. This is a project that was developed by the CDC, the American Public Health Association, and the National Association of County and Health Officials all together. So these three organizations came together and developed this model. And what sets this model apart from the patch model is that this is a model used solely for local health departments. So if you work in a health department, you've probably seen this model before. The APEX-PH is a three-part process that helps local health departments assess their organizational capacity, identify community health issues, and develop action plans. So this model, again, is used solely for local health departments, and it is a way for the departments to determine if they have organizational capacity to meet the needs of the community's health issues and to develop action plans. And this model has three parts: organizational capacity assessment, community process, and then completing the cycle. So you can see how, these themes from the generalized model sort of come through in these other models as well. The MAP model is mobilizing for action through planning and partnerships, MAPP. This model has replaced the APEX-PH for the most part, but you still may see the APEX-PH here and there. But the MAP model has come into favor because it has broader implications than just inside of local health departments, which seems to make sense because we want our models to be broad enough to be applicable in many different settings. The MAP started with just the MAP, and now we're up to MAP 2.0. And MAP 2.0 provides a structure for communities to assess their most pressing population health issues and align resources across sectors for strategic action. So you can really see that this is a more modernized approach where we are engaging communities and asking communities to tell us what are their needs. This is really important because if we don't live in a community or we're not part of a community, it may be very difficult for us to determine what the needs are. Once we know from a community what are their health needs, then we can work with the community to line up resources for strategic action. And the MAP model, again, is updated and it focuses more specifically on health equity within communities. So these are some things that you don't see in the other models, but that you do see in the MAP model. And you can see on the left-hand side, phase one is to build the community health improvement foundation. So getting the word out, building a team, looking at, okay, we do want to improve the health in this community. How do we do it? Well, we go to step two. We tell the story about the community. We have a community partner assessment. We look at the status assessment and we consider that community assessment within the context of the history of that particular population. And then phase three is that we work to continuously improve the health of the community. You can see on the very bottom there, I have a website. Going to that website and really understanding the model is not something that's required for the exam. Just have a working knowledge of what this model is about. But this is, like I said, a newer model. And if you're not already using it or not familiar with it, you can go to the website there on the bottom and get more information about it. There's a whole toolkit there that might just help you in your practice. And then our last model that we'll talk about is called the MAP-IT model. And this model was developed to help communities implement Healthy People 2020. I do realize that we are beyond health HP 2020, but this was where this model started. So This model came about to help communities implement Healthy People 2020. It can also be used for, all of the Healthy People documents as well. So MAP-IT is, again, an acronym like others. The M is mobilize key individuals and organizations that care about the health of the community into an organization. Assess community needs, strengths, and resources to address the target health issue. P is plan your approach and create an action plan with concrete steps for the vision of the coalition. I is implement your plan using concrete action steps that can be monitored and will make a difference. And T is track your progress over time. So again, even though this is a specific model to help communities implement facets of Healthy People, what you see here are threads again of that generalized model, bringing people together, assessing needs, planning, implementation, and evaluation. So that's the overall picture of these models, but you can see that different models have also been created for specific circumstances. And that's really, when you're thinking about preparing for the exam, that's really the meat and potatoes of what you want to know about the models, which model was created for which purpose. So with that, let's do some practice questions before we have a little break. So practice question 6. Most planning models include elements of needs model, generalized model, Healthy People 2030, or a general adaptation model. Okay, it looks like most of you got that one correct. That is right, the generalized model. And let's take a look. We'll look at our correct answer. It is the generalized model. Remember that generalized model is just what it says. It's a general model just to put the pieces together. It's always going to be assessment, planning, implementation, evaluation. And that's what that generalized model really tells us. So good. Okay, you did okay with that. The program planning model developed for use by local and state health departments is MAP-IT, generalized model, patch, or MAP. Okay, so most of you got that one correct. A little shaky on the models, and that's okay. That's why we're here, so that you can get a sense for, what's important. So let's take a look at the answers here. And the correct answer is the patch model. Remember that MAP-IT was created for Healthy People 2020. Again, I know we're beyond 2020 now, but that's where it was created. That generalized model is just what it says, a general model. And MAP was developed. I'm sorry. The patch model is the correct answer. And just a note that the Apex PH was developed for local health departments. So this one, patch, was developed for local and state health departments. Okay. All right, good. And we'll move on to our next one. The apex pH has essentially been replaced by which of the following? Good. Okay, most of you got that correct. So let's take a look at, I'm just going to go to the answer slide. So it is MAP. And remember that MAP is the original, but we're up to MAP 2.0 now. Maybe one way to help you to remember this is that MAP is one of the most modern, MAP 2 is one of the most modern frameworks that we're using right now. And this is the one where we're really focusing on health equity and, engaging community. So um, if you see something, out there about MAP, MAP is the most up-to-date one, and the Apex has mostly been replaced by that because it includes, more facets and more focus on getting the community involved. Okay, our next question. MAP-IT was developed to allow communities to track their own adaptation of Healthy People 2020, the Generalized Model, Patch, or Apex PH. Okay, good. Most of you got that one correct. So MAP-IT is the model that was created to help communities track their own adaptation of Healthy People 2020. The generalized model, again, is general. Patch is for local and state health departments, and Apex was for just local health departments. Okay, there you go. And our last question for this section, this is a bonus question again. So you probably won't see questions that are like this, but this one is just to kind of get you thinking in this direction. Which of the following is not part of the generalized model? Developing interventions, evaluation, choosing a target group, or assessing the need? Okay, you did really well with that. Good job. And again, you probably will not see a question like this on the exam, but this is another one of those that, I just wanted you to think about if you know the process of evaluation and you know, okay, this is correct, this is correct, this is correct, this one is not correct. Think of it like a true and false, and that might be a good strategy to help you through some of these questions. Okay. And choosing a target group is part of the patch model, not part of the generalized model. Okay, so you guys all did really well with that. So thank you so much. And I think what we'll do now is just have a little break for you. Is 10 minutes okay, Ashley? Okay, we'll do 10 minutes and I'm on East Coast time. So for me, that will be coming back at 3:10. So wherever you are in whatever time zone you're in, just about 10 minutes and then we'll come back together and we'll wrap up for our time for today.
Okay, good.
I'm cheering you all on too. That's fantastic. Oops, let me come out of here. Okay, looks like we're back.
Yeah. So I think the NATO link that you sent was just to me, so I'm gonna reshare it out to
Oh, I'm
everyone.
sorry. I
Yeah,
saw
no
that someone
problem.
was having trouble getting into the site.
Yep.
And I want to say too that on that website, there is a way to sign up for a newsletter
Okay.
as well. So if you're interested in that and you want to follow that, you'll get emails periodically from them. So that's pretty nice too. Okay. Yeah, sorry, I don't know who I'm responding to.
It's confusing because it changes based on who's if you're replying to someone. So yeah, I get it.
Just so everybody gets what they need.
Mhm.
Okay, let me hide my little floating panel. Okay, so I think we are ready to begin our next section. So far we have talked about program planning, how to plan a program, and then we've talked about program development, and we've talked about some general models for developing and evaluating programs. So we're going to focus in now on specific models for planning health promotion interventions. And you may not have been as familiar with some of the other models that we talked about today, but I think that this is one that you're all going to feel pretty comfortable with. Um, this one is the Precede-Proceed model. So I don't know, can they raise their hands, Ashley?
Yes, yes, you can.
Okay, if you have ever heard of this before, please raise your hand. I just want to get an idea of how familiar you are with this.
It looks like out of the 103 people, we have 21 hands raised right
Okay,
now. So
all right, that's okay. That's all right. So this model is specific to, like I said, to health promotion, and it's used very frequently in public health. And it has two parts. It has the precede part and the proceed part. And I will show you what the model looks like as an image as well. Um, but the precede part is includes predisposing factors, assessing reinforcing and enabling constructs in education and ecological, and diagnosis and evaluation of the population. So you can see the PRECEDE right down the line there. And then the proceed part of the model you can see is policy, regulatory, organizational constructs in, excuse me, in education and environmental development. So you can see that these are mnemonics for these terms. And if you can keep in mind that everything before you proceed has to precede. All right, I know that that sounds a little silly, but let's take a look at what this looks like. The Precede-Proceed model has been through several iterations. You're not going to be asked about all of the different iterations. It is one of the most widely used and accepted models of health promotion programming, and it has 8 phases, and they go right along with the letters. So the precede phase really focuses on assessment. It looks at social assessment, epidemiological assessment, educational and ecological assessment, and administrative and policy assessment, and then intervention alignment. So if you could remember, I have to assess before I can implement anything, you are golden. That's what this model is all about. It's about assessing the needs before we move forward with an intervention and evaluation. So precede is all assessment, proceed is all the interventions and evaluation, and that includes implementation of the program, process evaluation, impact evaluation, and outcomes evaluation. So again, precede is everything that comes before interventions and evaluation, right? So that might be a little way for you to be able to remember this a little more easily. This is what the model looks like. It is very busy. Do not get lost in the details here. You are not going to be asked specifics about the middle of the model. I just want to show you this. If you start on the right-hand side of your screen up at the top, you'll see where it says Precede Evaluation Tasks, specifying measurement objectives and baseline. Just under that on the right, you will see phase 1, social assessment, phase 2, epidemiological assessment. Moving to the left, phase 3, educational and ecological assessment, phase 4, administrative and policy assessment, and intervention alignment. So again, right across the top from right to left, you see all types of assessment. Once you have completed your assessment, all the way on the left, you'll see that blue box that says health promotion. I'm sorry, health program. And then you'll see educational strategies and policy regulation organization. That is where we will start to combine what we have learned about assessment with moving forward to developing the program. And you'll see on the bottom left is phase 5, implementation of a program. So you can see right across the top, again, just to review, right to left, it's all Precede, which is assessment. Implement the program is on the very bottom of the left, and then you're going to move from left to right. That whole bottom part of the model is Proceed, which involves implementation, process evaluation, impact evaluation, and outcome evaluation. So we're assessing, implementing, evaluating. It's actually very familiar. Pieces of this come from that generalized model. So this isn't something entirely new. It's just that it's kind of, it is a busy model. If you look back in the center of the model where you see the health program, you'll see that everything in green is what we're going to focus on in terms of health changing. So we're looking at predisposing factors, reinforcing factors, and enabling factors. And you can see that all 3 of those contribute to behavioral change. Other things that contribute to behavioral change are the environment and genetics. And then moving further to the right, all of these 6 factors have an impact on health and then quality of life. So this is an overall model, and we're looking at, again, assessment, implementation, evaluation, and that health promotion piece is in the center. And it's really focusing on how do we achieve a better quality of life through better health, and how do we focus in on these pieces of the environment and even within the individual to help to improve health and quality of life. That's pretty much all you'll need to know about the Precede-Proceed model. You're not going to have to memorize all of these pieces, just have a general sense of what the model is all about. So now that we have our models and we know, all right, we can assess our communities, we can assess their needs, how do we then move into developing interventions? So that's the piece that we haven't really touched on yet, and we're going to move into now. So intervention planning, development, and implementation is our next piece that we're going to look at. And in terms of developing interventions, the first thing that we want to do is develop goals and objectives. And just again, as a reminder, goals are a little broader than objectives. Objectives have to be very specific. And to do this, we'll identify a set of activities that will help the population meet those goals and objectives. And this is how we're going to develop these interventions. We have 2 ways to do this. You will see that on the left side of your screen, on the very bottom, we can review interventions or activities that are already in place. That is probably our most straightforward way to develop interventions. We look at what's already there. We may review them, we may modify a few things, tinker around the edges, but it is much easier to see what other interventions have been developed and use those that are already there. Another way to do this, you'll see on the right-hand side, is to adopt or adapt existing programs. This is very cost effective, and it's something that's familiar to the population. So if we are, I'm going to again use that smoking cessation example. If there is already a smoking cessation program in place within a population, it has a name, people are familiar with it, they may have friends or family members who have attended this program and been successful. We don't want to come in with a brand new intervention. We want to have something that people are familiar with. And so that helps us not only to be more cost effective, but also to draw individuals and populations into this. So if we are adapting an intervention or a program, there are some steps that we need to take. And you'll see this across your screen. The first step is to review the existing intervention or program for timeliness, accuracy, and effectiveness. So we're always talking about evidence-based interventions. We would review this program to make sure that everything is evidence-based, that it's up to date, that it's clean and shiny and new, and that it's all accurate. The second step is to ensure that goals, objectives, and interventions are evidence-based. So things do change over time. We gather new evidence. We have to go back and look at some interventions that have been recommended and make sure that those things are still the same. Just because they have worked for us with certain groups doesn't mean that that is what the literature tells us. So we want to make sure that everything that we're using or recommending is evidence-based. The third step is to incorporate empirically tested interventions. So if we find that something is not up to date or evidence-based, we're going to change that piece of the program so that we modify anything that's outdated or that has been shown to be ineffective. The fourth step is to determine the need to adapt the intervention or program to the target population. So this piece is really, really important, along with the fifth piece. We have to consider the fit for the target population because every population is going to have different social determinants of health. They may need a different delivery design, and they may have cultural needs as well. So we don't want to just wholesale pick up a program that has been used before and maybe move it to a different population or a different place because the needs could be very different and that group could be very different. So before we implement a program, we want to really thoroughly consider the population that we're working with and whether this program will be a good fit. One of the easiest examples that I can give you for this is that if a program was implemented online during the pandemic and now we're going to do it as a face-to-face program, we have to think about, will people come to it? Are they going to show up in person? When we're in person, we need to do a lot of ice breaking. We want people to, talk to each other and develop some relationships with each other, which is really different from the online learning environment. We also want to think about, again, cultural factors. What works in one group may not work in another group. So this is where we really need our stakeholders to be involved, particularly members of the community where the program will be implemented so that they can help us understand what is going to work and what is not going to work if we're moving this program somewhere else. And I have a big note in yellow there. Any new interventions or program modifications, if you're going to move this to another place, if you're going to use it with another group, it should be pilot tested first in the target population. So for example, if you are running a prepared childbirth class in a middle income suburb where people are mostly married and they have money and they have two incomes and they're all prepared and excited about having children, that childbirth class may need to be modified if you're going to use it in an inner city with teenage moms who have a completely different set of needs and concerns. So before you roll out the whole program, pilot test it with a small group to see if it works, and then you can get feedback and modify the program even more. And we're going to talk about that when we talk about evaluation of programs as well. But let's just practice with these, the last model and then our interventions. So the Precede-Proceed model is a model that is commonly applied to community assessment, planning health promotion interventions, disaster management, or stakeholder engagement. Good. Okay, excellent. So that is the Precede-Proceed model is a model that is applied for health promotion interventions. And we'll show you the correct answer there as well. Good job. Question 12. The Precede portion of the Precede-Proceed model involves assessment, planning, intervention, or evaluation. I said this a couple times, so make me proud. I'll see if you're paying attention. Okay, most of you did get it. The Precede is assessment, which always comes first, right? We always want to gather data before we can move on to planning, intervention, and evaluation. And if you didn't get it right, that's okay. That's the whole point of doing practice questions, that we can kind of see, oh, okay, that's an area that I just need to brush up on. So don't feel bad about that. Everything's cool. This is to also help you to figure out, all right, I knew other things, but this might be just something to really focus in on. And so there's your correct answer. So this one, hopefully you'll know, the proceed portion of the Precede-Proceed model involves assessment of needs, planning programs, intervention and evaluation, or modification of the program. And you can eliminate one. So this is a 1 out of 3 situation. Okay, good. So most of you did get that. That's excellent. That proceed portion of the Precede-Proceed model does involve that bottom part of the model, intervention and evaluation. So good job. Excellent. Okay. We'll move on to another question. Developing evidence-based intervention requires testing the interventions in various populations, reviewing the evidence on the intervention, assessing stakeholders' opinions of the intervention, cultural awareness, and linguistic sensitivity. This one's a tricky one, so take your time. Okay, so it looks like the greatest number of people did get the correct answer, which is reviewing the evidence on the intervention. And this one was a little tricky, so I do have some rationale here that I want to just touch on. So the first distractor was testing the interventions in various populations. So this may be part of the evidence that is published, but the program developer does not have to do the testing in various populations. So you're not going to have to actually go out there with an idea that you have and start running it in all different populations. That's going to be part of the evidence that's published that you're going to review. The third distractor was assessing the stakeholders' opinions of the intervention. And this one will stick out to you if you see it on an exam because opinions aren't evidence-based. All right, so we always want to go back to just evidence. And assessing cultural awareness and linguistic sensitivity. That is also something that is extremely important. That's probably the one that I would be pulled to if I didn't create the question and know the right answer. But cultural awareness and linguistic sensitivity is also going to be something that's going to be in the evidence that you review. So that's not something, again, that you have to go and test on your own. All right, so this question was a little bit harder. But if you see something like this, any distractor that says evidence, reviewing the evidence, that's where you want to head, is right for published evidence. Okay, good job. All right, and we'll move on to our last piece. This one is program evaluation. So we have talked about assessing, doing a needs assessment, coming up with programs and interventions, and how do we develop those interventions, and what models do we use to help us do that. So now we've done all of those wonderful things for our population and our community, and how do we know if it was really effective? So program evaluation, when you're thinking of definitions that you want to have nailed down, this is one of them. Evaluation must be systematic. It is used to establish the merit, worth, and/or significance of a program. And that comes from the CDC. So that's a source that, is very credible. So that's your definition of program evaluation. And how are we going to do that? It has to be systematic. So we're going to talk about how we can systematically evaluate a program. Evaluation also demonstrates the cost-benefit ratio of programs. We've talked about that. That doesn't always have to be money. It also demonstrates the effectiveness of the program and the potential need to modify the program. And so, again, we want to look at this systematically, and there are three main types of evaluation. The first is formative. The second is what we call a process evaluation. And the third is summative or summative. I've heard it pronounced both ways. You can pronounce it how you want. I'm not going to correct you or judge you. So these are our three types, and we'll talk about each one of those. So our formative evaluation is used when we're developing the program. Now, it sounds weird to evaluate a program when we're first developing it and haven't really implemented it yet, but this is any evaluation that is used when we're designing the program. So this can include evaluation of the evidence, like in that tricky question that I just gave you. Once we have all these studies pulled together and we know what works, how do we really evaluate that evidence? That's part of our formative evaluation. We look at similar programs and compare how other programs did things, and that's part of our formative evaluation. We can run pilot tests. So that's what I was saying before. If we're moving a program to another population, we want to pilot test it with a small group first. And a big part of our formative evaluation is that needs assessment that we talked about in the beginning, which helps us to understand what is needed and how the community would best receive it. So that's all part of our formative. Think of it as forming, right? We're forming our program using a formative evaluation. The second type of evaluation that we'll talk about is the process evaluation. Using a process evaluation involves measuring and describing implementation of a program. And there are models that we use. The empowerment evaluation. In this model, we encourage stakeholders to offer feedback throughout the implementation of the program. And this is a participatory process that enables change during implementation. So just to be clear on this, formative is while we're planning the program. Process is while we're running the program, right? So there are two ways to evaluate this while you're running the program. The first one is empowerment. So we're asking people in the program, how are things going? Is there anything that we need to change? And then we change it while we're actually in, running the program. The second approach to this is the continuous quality improvement approach. And this is based on the plan, do, act cycle. And it allows for change during action sessions between sessions. So as opposed to the empowerment evaluation, if I'm running a program and someone says, this program would be much more effective for me if you didn't use PowerPoint slides. I find them very distracting and I don't like them. And then I said, okay, I'll do a portion of this program without slides. That's empowerment evaluation. In this continuous quality improvement model, I would run each section of the program as I had planned to do it. And then I would ask for feedback after each section. And then during action periods, I would change things between sessions. And the CQI also involves continuous data collection and assessment to help modify the program. But again, they're not modified while the program is actually running that session. They're modified between sessions. But these are both types of process evaluation because they're occurring while the program is running. The last type of evaluation is the summative evaluation. And this is I like to think of this as a summary. It occurs after the entire program has been implemented, and it measures short-term and long-term impacts of the program. It should and can include both quantitative and qualitative data to capture a more robust understanding of the participants' experiences. When we're using quantitative data, we're giving people a survey, we're asking them to rate the program, but by allowing them space to really say what they're thinking, we capture more dimensions than we might be able to think of. And that's particularly important if we're not a member of that target population, and we haven't thought of everything that could be important to this population. So the general steps of program evaluation are to engage stakeholders. And this is also to help interpret the results and validate the findings, to describe the program. And this is to be sure everyone recalls the purpose and objectives. And these steps are going to be in your program evaluation report. So whenever we implement a program, we're going to write up a report, an evaluation of how it went. And these are the things that we'll include in that report. We want to gather credible evidence. And again, we're going to use quantitative and qualitative data from the participants in the program. We'll justify our conclusions. So we don't just want to say, wow, that program was great. We need to say, well, participants liked this aspect, they didn't like that aspect. And we pull our conclusions from the data that we've gathered. And then we share lessons learned and we engage stakeholders in finalizing and disseminating the results. This piece is really important because when other people are running programs like this, they'll go back and look at what you've done to be able to say, okay, could I run this program in another population? Or what are some pitfalls that I should think about? So this is where you will share your lessons learned, and that will help others who are developing similar programs. And we always want our evaluation to align with the standards for program evaluation that have been developed by the American Evaluation Association. I bet you didn't even know there was such a thing, but here they are. The first is systematic inquiry, that the evaluation must use a framework to ensure that the results are accurate and credible. Competence, that there has been expertise in developing and conducting the evaluation, as well as cultural competence that pertains to the target population. That the evaluation has integrity and honesty, that there was accuracy in sharing the results and disclosing any conflicts of interest. 4, that respect for people, this ethical principle, was infused into the evaluation report. And this involves consideration of the political climate, research ethics, social equity, and the potential impact of the results on the target population. And 5, responsibilities for general and public welfare. And this takes into account the wide-ranging needs of the target population and other stakeholders as well. So with that, let's do our last round of practice questions. An evaluation conducted after a program has been fully implemented is called formative, process, summative, or outcome. Okay, summative, excellent. So try to remember that summative is like the summary. That is the outcome after, the assessment after the program has been fully implemented. Formative is while you're planning the program. Process is during the implementation, and outcome I just made up. And there it is. Okay. Okay, so program evaluation is an important tool for demonstrating community interest, cost benefit ratio, funding support, or community partnerships. Good. Okay, so the greatest number of answers does show up in the correct spot and that is the cost-benefit ratio. So these other things are good information, but when we look at what program evaluation must include, one of those pieces is the cost-benefit ratio. So that in the beginning, when we were trying to gather support, remember for our program, we wanted to show the cost-benefit ratio and estimated what the cost-benefit ratio is. After the program is actually implemented, we want to show what the actual cost-benefit ratio came out to be. Okay. All right. Good job, though. Question 17. An evaluation that is used when designing the program is called formative, beginning, process, or summative. Hey, great. Okay, wonderful. So formative is the type of evaluation that is used when we're designing the program. So you're doing great. Look at all your learning. Wonderful. Okay, you are getting there. That's perfect. So that is formative. And if you didn't get it, that's all right. Remember, this is all just about learning and picking up on areas to continue to review. That's okay. Question 18, which of the following is the most credible source of data to use for establishing the need for a new program? Okay, so this one was a little bit of a mixed bag, and that's okay. This one was a little bit harder. And the reason that I put this in here is that I wanted to stress again that evidence-based practice, which is a word that we use a lot, but we don't always talk about what it really means. So your correct answer is the county mortality statistics, but I do want to talk about the other ones just so that you have this nailed down. Community leader opinions, anywhere that you see the word opinion, that means that it is not evidence-based because it is an opinion, even though they're community leader. Past practice could give us some information about evidence, but it doesn't say that that past practice was based in evidence. So you can't assume that part, right? This is just something that someone did before. And the windshield survey gives us some good information, but remember that pieces of the windshield survey are really based on our own judgments of what we see when we're conducting that survey. So the most credible source here is number one, that community mortality statistics, because that data has been scientifically gathered and presented. Okay, so good. All right. Number 19. Continuous quality improvement is a good approach to use when providing rationale for program modification, establishing a new program, the entire program has been completed, or there is a complaint about the program. Okay, good. You did well with that one. That's good. That one was a layered question, so that one was a little bit harder. So to answer this question correctly, you had to know what CQI is, and you had to know that it's a type of formative evaluation. So that's pretty tough right there. And then you had to know that, okay, if I'm sorry, it's a type of process evaluation, then you had to know how does that all work out. So the process evaluations are used while we're implementing the programs, and it gives us feedback for modifying the program while it's actually being implemented. So if you didn't know that one, that's okay. The wrong answer is just the way to learn something new. And if you knew all the answers, we wouldn't need to be here. And I want to make sure you're getting your money's worth. Okay, so last question. Which type of evaluation is used during implementation of a program? Formative, process, ongoing, or summative? Yay. Yeah. So you have it nailed down. Perfect. So while the program is in process, we are using a process evaluation. Formative is while we're forming the program, we're getting it together, and summative is the summary, right? That lasts after it's implemented. Good job, everybody. Okay, and that is the end of our time together. Our little quote is that perfection is not attainable, but if we chase perfection, we can catch excellence. And that's what I hope for all of you. You do not have to get a perfect score on this exam. You just need to pass it, and then you can show your excellence through your certification. So thank you all for spending this time with me. Does anyone have any questions that I can hopefully answer for you?
We do have one question about,
Sure.
this is a little farther back. It said, what does SDOH stand for?
Oh, good question. Social determinants of health.
Oh,
Sorry, I should have spelled that out on the slide. Yeah, I'm sorry. That is social determinants of health.
and then the other question I have up here is, or would you say that achievable is more assignable to specific people, since realistic seems like the same thing as achievable?
Hmm, that's a good question. Yeah, I guess it could be viewed in that way. I hadn't really thought of it that way, but achievable, yeah, achievable does mean, can it be done? And realistic means, is it realistic? Can this actually happen? So they are, sort of close together. There's a very fine line between them. The acronym is just to give you an idea of how to formulate objectives. So I don't think, that's good information for your own knowledge, but I don't think you're going to have like specific questions on the exam about the differences between those.
Okay, it doesn't look like I have any more questions coming in right now. So we're getting lots of praise. Everyone seems to have
Aw.
enjoyed the session. So thank you,
Thank you,
Dr. Wright.
everyone. You're the best. I really, really love doing this, and I love spending this time with you. And I wish you all the best in taking this exam. I'm really excited for you. It's going to be great.
Yeah. And then I was just going to let you know our next session is on communications this Thursday. So I hope to see everyone there. And we did reschedule the policy and advocacy section for the end of the series. So that'll be on Tuesday, the 27th. So thank you, everyone, for being here today. Dr. Wright, a special thank you to you for your time.
Thank
And
you.
we will see everyone on Thursday. Thank you.
Bye, everyone. Take care.